The truth is, the secret to most spine recovery isn't about the tissue. It's about biomechanics, how your spine moves and how your spine loads. Mechanical back pain happens when those movement patterns fail. Combined medical expertise and biomechanical analysis, the diagnostic rate reverses from just 15% to over 90%. This kind of specific spine diagnosis is the key to healing. Why? First, knowing the pain triggers allows you to avoid the specific movements and loads that keep re-aggravating the injury. Removing those triggers stops the cycle of irritation and lets the pain wind down. Second, we can train within the pain-free tolerances. Tolerances define the safe zone, the range of postures, loads, movements, and exercises your spine can handle without flaring up from micro-trauma, small damage from doing the wrong thing. That safe zone becomes the training grounds for recovery. Third, we adapt. As healing begins, inflammation subsides, and tolerances expand. Gradually, you can build durability and resilience. That's the essence of a biomechanical approach. Identify the mechanism, remove the triggers, build capacity intelligently. This approach depends on an individual analysis of your medical condition and of your biomechanical features. Let's talk about what this looks like in real life, because once you see the framework, it's clear why certain movements hurt while others feel safe. Let's take disc pain. Pain from an injured disc often comes from repeated forward bending under load, like sitting slouched all day or doing too many sit-ups. Each of those forward bends adds what's called a flexion stress to the disc. Eventually, the disc fails. The first step is to remove that trigger. Teach the hip hinge, for example. Bend from the hips instead of from the spine. Then we identify the tolerance. For most people, that means staying within a neutral or slightly extended posture early on. As the spine calms down, the safety zone expands. Another example could be spondylolisthesis. That's a complex spine term, but you may have heard it if you have this diagnosis. In a spondy, as we call it for short, there could be a shear intolerant pain. You might feel fine walking, but bending over, sitting, or carrying something uneven might trigger your symptoms. The shear load is a small slipping kind of motion that occurs between the bones of your spine, known as the vertebrae. This tolerance can improve when we emphasize stiffness and bracing to restore control. A third example, particularly if you're on the older side, is tissue sensitivity from facet arthritis and irritation. In this case, the joint has become hypersensitive from overstress and is inflamed. To desensitize the system, we might use gentle, tolerable movements and chunking activity. For example, taking one long walk and breaking it down into two shorter walks. In all of these examples, the same principle applies. The pain isn't random, it's mechanical, it's predictable, and once you understand the mechanism, you have a roadmap to design the treatment based on this mechanical logic. If you're interested in a comprehensive spine evaluation that combines medical expertise with biomechanical analysis and coaching, visit masterymedical.com.